That sounds like such an easy thing for patients to engage with, something that's simple but dangles the carrot. I mean, heck, I want to engage with this. I want something like this for me.
Just want some money.
I
just
do.
wants to get paid.
Yeah, I do. I mean, let's go.
Welcome to the Healthcare Grind, where we cut through the noise in the healthcare industry to bring you the latest trends, innovations, and insider insights. I'm Jess Hearthcock, and I'm joined by my co-host, Lon Hecht, as we embark on a journey to connect early-stage healthcare companies, payer executives, and investors with the knowledge and perspectives that matter most. Get ready to grind in the fast-paced realm of healthcare innovation. And for more advanced content, go to healthcaregrind.com.
Hey, everyone. Welcome to the Healthcare Grind. It's great to have you back again. Once again, this is Lon Hecht, and I'm joined by my co-host, Jessica Hearthcock. We have a fantastic guest today. We have the co-founder and CEO of a company called Reciprocity Health, and that's Matt Swanson. Matt, can you say good morning to the audience?
Hi, great to be here. I'm excited for this conversation with you and Jess.
Thank you. We're really excited as well. So, you know what? We want to kick these episodes off with maybe a 30 to 60 second elevator pitch. The goal of these episodes are for executives and investors and others to be able to, on their drive time to work, be able to listen to a 20-minute episode and learn something new about a company that might be able to fill a void and help them out in some way. So could you give us a quick elevator pitch on your business?
Yeah, we have recognized that a huge component of moving towards success in value-based payment really involves an active role from the patient. So we have taken behavioral economics, built a team that can use a platform that we've built to drive acceleration in patient engagement in care journeys. And so using financial incentives and other behavioral economics tools, we're able to accelerate adoption and adherence to critical care programs in chronic condition management, episodes of care like high-risk maternal health, or transitions of care like a hospital discharge, in order to bring that patient more into that active role with their provider and create healthier outcomes at lower cost.
Awesome. Jess, I know you always like to go into founder story. I have so many questions for Matt, but I'm gonna hold off for a minute. Why don't you jump in?
I love a good founder story, Matt. So can you give us just a little more background? How long has the company been around? Why did you found it with your co-founder? Just tell us a little bit more about the need that you saw to make you want to act on this.
Yeah, so it actually goes back 10 years, not the founding of the company itself, but the reason behind it. I was brought in by the governor of Delaware to head up work on a CMS-funded initiative to move the entire state of Delaware from fee-for-service into value-based payment. And we put together a really high-powered board with government leadership, payer leadership, health system leadership, to put together a unified plan that could be presented to CMS for federal funding for this work. They were doing a statewide innovation model plan at the time. We had an excellent application, received just under $40 million in funding, and we founded an organization called the Delaware Center for Health Innovation to really oversee all of that work, and I chaired that work. During that entire orchestra of activities, from technology to workforce development to population health and obviously payment model reform, we identified a sort of critical missing link, which was the patient's role in all of this. We had providers who were coming to us and saying, we understand this shift towards value-based payment as critically important for the industry, but they also thought it was patently unfair that they could do everything right, give all the right advice while they were in the four walls of their office. And then the patient would go off and do whatever they would. And yet now we were asking the providers to be held at risk and accountable for the outcomes in a much different way. So that bothered me. And I really wanted to try to provide a solution. And so stepping back, I really recognized that in essence, value-based payment was through a contract, payers getting comfortable with paying incentives to providers to drive a behavior change, to take cost into consideration and other factors. At the same time, I said, well, if payers are getting comfortable with paying financial incentives, how about we start directing those incentives towards the other stakeholder group in this equation, which is the patients? And so that became an exercise in the actuarial challenge of, can you show the ROI for paying patients financial incentives? And then also the behavioral economics component, which is, how do you drive healthier decisions? We did that foundational work, found out that CMS was doing a lot of field testing in that same vein. CMS's conclusion was it was really valuable work that when done well is extremely effective, but it was so complicated that they surmised that no one would be able to commercialize it. So we took that on as our challenge. We built a platform to prove CMS wrong, and built a team around it. We started building the technology in 2020, started taking that classic entrepreneur's route of building an MVP and testing it. We built an MVP in 2020, and everybody was more interested in pandemics at that time than testing our platform. So we decided to step up, get more investment, and just build the entire commercial ready platform, which we launched in late 2022 and have been running ever since.
That's great. So I have so many questions, and I think Jess and I will probably go a little rapid fire on you if you don't mind. So first of all, love what you're doing. I actually have a background in patient engagement. There are a lot of companies that do patient engagement, but I haven't heard many that are really focused on the financial end of it, on putting incentives out there. So I absolutely love that. So my question is, and it's kind of twofold. One, the quick fire is, what is a typical ROI on that? Because I think the people that listen to this podcast are going to be interested. And then how do you do it? Like, can you give us some examples or maybe just an example? Sorry, it's rapid fire. So that's two pretty quick questions right there, but let's go for it.
Yeah, absolutely. We actually develop an ROI model on every single campaign because they're so very different. If you're building financial incentives to drive adherence to a high-risk maternal health program, now you're avoiding the NICU if you're successful. The ROI on that is immense.
Right.
So that's very different than, let's say, a hospital discharge program where you're getting somebody to visit their primary care, do their medication reconciliation, get some other facts in that 3 weeks that are critical after your discharge to prevent a hospital readmission. It's a very different ROI model that happens over 3 weeks as opposed to high-risk maternal health that happens over maybe 6 months of a pregnancy versus a diabetes management program, which has an even longer horizon. So you really do need to build those models for each and every program. But we've been seeing incredible increases in participation with these programs that we're accelerating. Each one of them will have an ROI that can range anywhere from $4 to $7 to $10 per invested dollar saved.
That's great. Are there any that come to mind that are just home runs? So like if I'm a payer, I typically have a bunch of different initiatives that are going on. So of course it needs to align with my initiative. But if there were like 2 or 3 that you're like, every payer should be doing this because it's a no-brainer, the ROI is so strong, it's a great way to prove value. What are 2 or 3 that come to mind?
Well, I think our HEDIS gap closure programs are that immediate visibility on ROI because you see so many different dimensions on how they pay off. So the quality manager is going to be extremely excited by the fact that we are able to close specific gaps. And let's look at their historical record on which gaps have been a challenge for them. Let's build specific rewards and outreach campaigns that really move the needle on those specifically. And there, if your state contract has either upside performance or penalties associated with a particular measure, that can be immense. That can be millions of dollars saved if you're just moving the needle on, a 10% gap closure up to 20%, which was the threshold. And all of a sudden they trip into an entirely different revenue stream. That makes the quality people happy. Then you shift over to the chief medical officer who has a particular mission around closing gaps on, let's say, high-risk maternal health. And then you really want to make sure that not just NICU avoidance, but all of the pediatric care and the complications that come out of many pregnancies. We've seen the ability to move the needle on that. And then you move over to the CFO's world, and they might be more interested in how you're activating the inactive population, let's say within a Medicaid population, because sometimes their yearly PMPM might be associated with the activation of somebody on a single claim for, let's say, a PCP visit. But then if you're now closing that gap on a PCP visit with certain broad Medicaid populations, we've tripled the PCP visits across that population. Now you're getting the possibility for different risk stratification based on that PCP visit. you're able to close other gaps and really address with a diagnosis the fact that somebody should be also participating in a diabetes management program or others. So it really blossoms all of these different ways. That single gap closures program can be serving all those constituents in different ways. And then fundamentally from there, you're also driving huge customer, client, patient, member satisfaction. They're earning rewards. They're feeling good. Everything we do is white labeled and branded to the client. So they're getting all of that positive equity from their members, decreases churn, decreases grievances, and all sorts of other things. So those broad programs really do pay off in a lot of different ways.
That is awesome. So I'm thinking I have a couple questions for you as follow-ups from that. So are there specific lines of business? I'd imagine if you're looking at high risk maternity, that's going to be more of a Medicaid focused program. If you're looking at, another specialty condition, multi-chronic condition, or, something like that, you're going to look at a Medicare Advantage line of business or Medicare fee for service. What are some of the different campaigns that you've run with your organization, different clients you've worked with, and how do you start to look at all the different factors like geography and lines of business when you run these campaigns customized for your clients? Can you tell us more about that process and how you think about it and how the company works?
Yeah, so flexibility to address different markets and different programs was really the foundation of what we built in the technology investment, that platform. It's flexible in terms of the behavioral economics. It's flexible in terms of the conditions and the programs that we're seeking to accelerate. So we started in Medicaid specifically and strategically because we knew historically, in terms of patient engagement, that's always been the toughest nut to crack. And if we could really show evidence of success there, that would help launch us into other opportunities. So I would say our specialty is in Medicaid right off the bat. But then we started going into other sectors, but sticking with that lower income, more vulnerable population. So we started moving into FQHCs and programs, diabetes management programs, HIV prevention, HIV management programs. We've got an IBD program and some others running through West Virginia Health Rate, which is the largest FQHC in West Virginia, and MedStar down in DC. So that was a new line of business and working with providers and systems. Then we started getting pulled unexpectedly into health systems, preoperative and postoperative protocols that led to more successful surgeries, fewer cancellations. So we worked with Maimonides up in Brooklyn. Yep. Yeah. And then we're moving up into upstate New York based on that success with health systems. And then we started getting pulled into the ACO, Medicare and Medicaid ACO space. We're launching new clients in that vein over the summer. We're trying to follow our success in the MCO space, Medicaid MCO space, and see where that tests into different sectors. Everything we do is based in human behavior, so it is going to be applicable and relevant to all these different populations, but how you interact with them is very different. How you work with each of those organizations is very different. And we're now getting pulled into MA and into the employer space. It's sort of a new breed of cat every time, even though we have some familiarity with what needs to get done with the member at the end user point. Each of the organizations in between is very different.
That's great information. Can you take us through, maybe if it's possible, keeping it to about 2 minutes, help us understand, what does the solution look like? Is it app-based? Is it SMS-based that feeds the app? Can you take a use case and explain what it would look like for the audience for a member so they can understand it a little bit better?
Absolutely. It starts with awareness. A lot of programs fail because they don't have the proper outreach. So we have built expertise in not just behavioral economics, but also consumer science. My co-founder, John Sylvan, comes from decades of experience in consumer engagement and understanding all of the tools and utilities and science and research that goes into getting people more active in a consumer journey. So we're taking all of that and translating it into a patient journey. It starts with outreach. It starts with awareness of programming. Then let's say we're working with a diabetes management program. People need to know that this program has been offered to them. Maybe they've seen it and were aware of it before and decided not to participate because there was reluctance based on confusion or overwhelm, intimidation, sometimes mistrust with the medical community. So people are actively turning away from a program that's been offered to them. Now we reach out to them with a completely different value proposition. Make yourself healthier and earn $200 in rewards at the same time. So the communication protocols are very, very different, very important. Then you do have the TheraPay app, which is a digital-based app, which is all about clarifying the journey in front of you, making it simple. We often refer to it as a friendly on-ramp into a care journey that has previously been ignored. So the app itself is going to tell you, yes, this is a 50-step program over 3 months, but let's just focus on the next 3 steps in front of you and the $5, $10, and $20 rewards associated with those first 3 steps. Let's get you started. It's offered in their native language. And so everything about it is about trying to address the access issues that people often turn away from. We do the outreach. We have a very easy registration process, multilingual. People can call in and register or use the app and register. Now they're on board. They have the app in front of them. Again, it's clarifying the path with the next couple steps in front of them. When they have registered with the app, they have at the same time received a reward card in the mail. It's a reloadable debit card. Oftentimes it will be branded to the client, as we said, for their rewards program. Some activities in any journey will be dependent on doing something outside of the app itself, going to get a lab screen, doing a primary care visit, picking up a medication. But there are several activities that we can actually build into a program right within the tool set in the app, taking an HRA screen or an SDOH screen, watching a 2-minute video on diabetes nutrition, whatever it might be. We are accelerating someone else's curriculum, someone else's program. And so we're taking all of that content and that journey, and we're either creating that roadmap on the app, or we're actually delivering some of the activities on that app. The ones that can be completed on the app are amazing because you'll finish watching a 2-minute video on nutrition and it will say, congratulations, you just earned $10 on your card. You get the notification. You go to the My Money section on the app. Your card balance just went up by $10. You can go spend that immediately. Other activities like going to a primary care visit or a lab test, we need to wait for a validation file from the client or from the HIE or maybe even claims that validate that was completed. But the member is then taken stepwise through that entire journey. They're earning rewards the entire way. And we are communicating reminders and nudges for folks who are getting close to the expiration of a particular reward. But through that nudge engine that we've built, we drive continued connection to the program, and the app is always there, a friendly little reminder and roadmap showing you what's next and how to get your next reward.
That is awesome. I mean, that sounds like such an easy thing for patients to engage with, something that's simple but dangles the carrot. I mean, heck, I want to engage with this. I want something like this for me.
Just want some money.
I
just
do.
wants to get paid.
Yeah, I do. I mean, let's go. I'd love to know. I mean, it sounds like you're experiencing fantastic success, incredible results. You're growing in all different types of ways into different verticals. What's next? What do you want to think about next for the organization? What are some of the next big growth goals that you want to achieve?
What's really interesting is we've been focused on particular programs. It might be maternal health here, hospital readmission there, and the flexibility allows us to go and really prove out these test cases. We've got a couple of bigger clients that are starting to get into this more enterprise-wide relationship. And that's what we seek to do more because there's a multiplier effect on the benefits that happen. When you engage a broader population in a number of different programs, let's say you use the HEDIS gap closures as this foundational program where you're reaching out to everybody. And then as you get tens of thousands of people who are now active in your program, they're sharing more data. They're filling out those SDOH screens. They're getting their health equity data input into the system because you have this really positive relationship with the member. We're giving you rewards and we would love some more information, know more about you. And we get their actual physical address, which is sometimes a real challenge. And how do you communicate with Medicaid members is always a challenge. So as you get that deeper and more active relationship with your members, all of a sudden, through that primary care visit or through the screening, you realize that there's a way you're not serving them in the best way you can. And now here's another program. We need to get this child into a lead screen. We didn't realize they hadn't gotten it before. we need to get this person into a diabetes management program. And so it now becomes, you have the single app and the single reward card, which is that relationship that gets members into all of these different programs. When someone goes to the hospital and has a hospital discharge, we immediately hit them with that hospital readmission program. They're familiar with it. They're like, oh, this is more money to go on the card I already earned money on. Let me go to the app and figure out how to follow those directions. So it all feeds on itself, and you build an ecosystem of rewards and higher adherence that pays off in so many different ways.
Very neat. So, hey, we're kind of running down on time. I had a couple quick things for you. At a really high level, investment. Where are you? Are you, seed A, B? Where do you sit? Are you looking to raise additional funds? That's the first thing. And the second one is, how do people get in touch with you?
Yeah. So we just closed, or in the process of closing a $5 million seed round. Labels get really interesting these days, whether you're calling things seed or Series A. But
congratulations!
Thank you very much. 2023 was not a fundraiser's best year. There was a lot of work that went into it. So it is not as easy as it used to be. We were lucky enough to be in a growing revenue position and a sustainability position where we were able to get it done with an excellent partner, Impactful Capital. So we're thrilled with closing that. And then looking forward, we're probably going to be doing a Series A in 2025. Yeah, that's the plan there.
Which means you're probably starting fundraising soon.
Yes.
Yeah. We know that drill all too well. It's a series for sure.
I'm taking a 30-day break. Yeah, exactly.
Good for you.
How can people get in touch with you if they'd like to?
reciprocityhealth.com is our website, and there are contact information there. I also welcome investors and clients to contact me directly at matt@reciprocityhealth.com. We have a business development team, but I really like to, especially with your audience, be speaking with people at the decision-making levels. I love doing a conversation like this because this is a complex product. It doesn't really play well with, bullet points on a website, and people really need to hear what the impact can be in the different ways we can customize a solution.
Thank you so much for that. One actually last following question. What about angel investors? Is that something that's of interest if angels are interested as well?
Yeah, absolutely. We, as we are closing out this $5 million round, which was institutionally led, both with our prior angel investors and people who have been waiting on the sidelines patiently, we're closing now, letting in folks who want to follow on to that lead investor. And they put together a great package that will show people exactly what the opportunity looks like.
Great. And a shout out to Impactful Capital. I know the folks over there are really good folks. So, yeah. Matt, thank you so much for joining us. Really appreciate it. I thought it was a great episode. If you would like more advanced content, please go to healthcaregrind.com. And please, when you have a chance, subscribe and continue to listen. We really appreciate the support. Everyone have a great day. We're going to wrap the episode now. Thanks.
As we wrap up this episode of the Healthcare Grind, we want to thank you, our incredible audience, for tuning in. If you found today's insights valuable, don't forget to hit subscribe and leave a review on your preferred podcast platform. Your feedback fuels our grind. For more exclusive content and updates, visit our website, healthcaregrind.com. Until next time, keep grinding, stay informed, and lead the charge in shaping the future of healthcare. This is Jess and Lon signing off from the Healthcare Grind.